After all, what is the normal size of a penis? This is a much discussed topic on the internet, in medical offices, and highly questioned in some internet forums, especially with the emergence of specialties related to genital aesthetics, penile aesthetics. Follow along with me until the end of this video, and I will explain what is considered normal in terms of length and girth, which is the thickness of the penis. For those who don't know us, we are the Dr. Men's Health Urology channel, where we provide tips and care for better male health, and now let's move on to the video. How to measure, and what is considered normal in the size of the male genital organ. First, I would like to make it clear that the good news is that the majority of patients who are concerned and come to the office with this doubt about the size of their genital organ, 95% are within the standard of normality. What often exists is a disturbance of self-image, as the patient, by using a comparison of pornographic movies or magazines, or even photoshopped pictures, considers himself different or even inferior in relation to the size of his genital organ. Another important thing to mention is that this is much more a male concern than a female one. It is believed, and this is a data from research and studies, that up to 55% of men do indeed have this concern, while only 5 to 10% of women consider it important in a relationship. So the first thing is to reassure the patient and explain that this is far from being the main defining factor in a relationship. Okay, but how can we make this measurement? Well, the measurement can be done in two ways, with the penis erect or in the flaccid and stretched state. In a meta-analysis, which is a large study conducted and it's a very comprehensive study, approximately 15,000 men were evaluated and the average length and thickness of the penis were studied. It was observed that 90 to 95% of patients had penile length between 10 and 16 centimeters in the erect or in the flaccid and stretched state, with an average of about 13.2 centimeters in length. Of course, this will vary according to ethnicity, genetics, and the region where the research was conducted. In relation to the extremes, we will have the micropenis, which is considered below 7.5 centimeters. This is indeed the target patient who may be of real interest for a penile elongation procedure. And there are also those with a macropenis, which is a genital organ larger than 24 centimeters. Regarding thickness, 90 to 95% of the men evaluated had their penis in the flaccid and stretched state, with a thickness of 8 to 10.5 cm, with an average of 9.5. In erection, the thickness can go for most patients from 10 to 13 cm, with an average of about 11.5 centimeters in thickness. As I said, folks, these studies are based on averages, where the regular, the most common found among the population, is considered. There are some patients who, although they fit within the standard of normality in the range I mentioned, are dissatisfied with the length or thickness of their genital organ. Nowadays, there is a lot of talk about thickening, penile and here, folks, I want to make an addendum about the importance of performing this type of procedure with a qualified professional who is able to handle the genital region. This penile thickening procedure, increasing the thickness, must necessarily be done by a urologist who is the professional most capable of manipulating this region and solving the consequences that may arise. What I advise is not to perform this penile filling, thickening with unabsorbable substances, such as PMMA, or industrial silicone, under any circumstances. Nowadays, what is widely used in a safer way is hyaluronic acid. Injection of this substance between the skin and the cavernous body can often offer the patient a 2 to 3 centimeters increase in the thickness, the caliber of their genital organ, of course being done by a professional with specific knowledge of the area. As for penile enlargement, lengthening is a more delicate issue. Unfortunately, no definitive procedure is considered by the medical board. Everything we have is somewhat experimental. Some surgical procedures, such as penile fat liposuction, may better expose the pineal shaft and give the impression of an increase in pineal length. However, what actually happens is that by removing local fat, the length of the penis is better exposed, giving the impression that the genital organ is larger. Additionally, there is another procedure, which is the sectioning of the pineal suspensory ligament, which can make the penis gain approximately 2 to 3 centimeters in length. However, the truth is that it can also lose its stability, which is related to the suspensory ligament. It is worth noting that penile prosthesis implantation is by no means considered a penile enlargement procedure. Penile prosthesis implantation is a definitive surgical treatment for erectile dysfunction. Both the inflatable and semi-rigid prosthesis are not considered penile enlargement methods. So folks, for those of you who followed this video to the end, now just a historical curiosity to show you how the perception of penile length has changed over time. In ancient times, in Greek mythology, or in other civilizations, we can observe that sculptures, statues, often depicted men with greatly reduced genital organs. It was believed that a smaller penis conferred greater control over a man's emotions. Those who could better control their instincts were considered wiser, whereas men with very large genital organs were considered more barbaric, devoid of much intelligence. Another example is Priapus, a god from Greek mythology, the son of Dionysus and Aphrodite. Priapus was a baby who, in a way, had a grotesque morphology, with a very large penis, a well-endowed phallus, and he was abandoned shortly after birth precisely because of his disproportionately large penis. Later, he was considered the god of fertility. This is just to illustrate that perception regarding the size of the genital organ is very mutable, and nowadays, with the advent of so many aesthetic procedures with the cult of beauty, unfortunately, this is put much more in focus and considered much more than it really should be. If you found the content of this video important, if you think it will help someone you know, then share this information. Don't forget to subscribe, leave a like on the video, and activate the channel notifications to stay updated on our weekly content. A hug, and see you later.